Health centers in Uganda have long suffered ill health themselves because of low attendance by the health workers. Concerted efforts, however, are addressing this problem, and the health centers are coming back to life, as New Vision TV's Jackie Achan finds out. In 2009, the level of absenteeism by health workers in Uganda was at about 52%, according to the Ministry of Health. Health workers were not showing up for work or were coming to work late, but left early to engage in other businesses.
At one point in time, patients would come very early in the morning, and by 4, he has not yet seen a clinician. So this person gets back very late in the night, very late at that communities. So it brought a lot of disagreement between the service providers and the community. And at one point, even they rioted. They walked to the RDC's office saying they have been since morning in the facility and they have never been attended to by any health worker. So, but these days it's not there.
Still in 2009, IntraHealth International and Ministry of Health introduced the Integrated Human Resource Information System in Amulata and 8 other pilot districts. The online open source monitoring system was to track attendance at work for each health worker. But the informatics developer at IntraHealth International, Dennis Chivye, says there was a breakdown in the use until 2015 when IntraHealth brought a central server and moved the system to the Ministry of Health headquarters.
All you need in HRIS is to have permission to. If you have permission to, from the Ministry of Health, right now it is being managed by the IT department through the coordination team. You can access any record anywhere because it is one system. That is why we have it called the Integrated Human Resource Information System. So you can access data for any district anywhere as long as you have access.
Beyond recording attendance, the Integrated Human Resource Information System captures biodata and professional records of health workers, plus the duty roster. The system has since been stable and greatly improved human resource management and provision of health care in the districts.
To report, and this one is used on a monthly basis, whereby in-charges, DHOs and COWs track attendance and absenteeism rate of health workers so as to talk to the health workers who are absenting from duty to improve their attendance to duty, and some are penalized. Because like in Uganda and Amulata district, they use this to generate the payroll. Depending on how many days worked, they are the number of days that are paid for.
Currently, one midwife has been indefinitely suspended in Amulata as a result of the reports filed on her through the system. Her luck ran out a month ago when she refused to care for 4 HIV-positive mothers who had come for ARV refills at the District Health Center 4.
The importance of this is that it helps us to have a track on the daily attendance. As you remember, in the public service, regular attendance of duty is a contractual obligation. So one is required to work about 8 hours a day, and that translates to 40 hours in a week, with the exception of the weekends. So if someone registers daily, and of course we expect that they go and do what they're supposed to do after registering, it helps you at the end of the day when you try to track it, to know who is giving their best in terms of delivering health service to the patient.
The Regional Human Resource Officer, Northern Uganda, Peter Alani, says to boost results, the district also introduced performance targets to work with the system. But Dr. Ebuku Ekwaru, the chairman of Uganda Medical Association, says the system needs to work hand in hand with incentives. But even with the success obtained so far with the Integrated Human Resource Information System, Alex Gwom, the focal person in Amulata, says taking records on hard paper and making it electronic has not been easy.
It is the automated attendance analysis. Usually we use the hard paper to analyze from the facility, then it's forwarded to to the district, and it's added to the system. So it's a kind of a process.
Sister Salome Adelo, who is in charge of the data collection in Amulata District Health Center, says the system can be time-consuming for latecomers.
The timekeeping, because when I remove the book by 8:30, I don't leave it in my office there. I move with it to my department where I'm working, because by that time I'll be working. So they have to look for me, and then those were some of the challenges they were meeting.
Currently, a team of IT experts from the IntraHealth International and the Ministry of Health are rolling out biometric machines to capture all data electronically. This eliminates any chances of a health worker signing in for a colleague, as the fingerprints are unique to each individual.
Things, an upgrade of a biometric, this would help for timely reporting on attendance. You know, we are still looking at 15 of the new month for the previous month. So biometric now would help on timely reporting. I think if they would improve on the area, it would help.
As for now, all 14 regional referral hospitals in Uganda and 14 health centers in Gombe, Adjumani, Kalangala and Katakwi have the biometric system installed. The Prime Minister's office is also supporting its rollout to 37 district hospitals and health centers in eastern Uganda. Another 197 health center 3s and 2s are getting mobile phones and automatic attendance registration.
The duty roster system and the attendance tracking system, which is a component of the HRS system, is running on a mobile-based platform, and it also has a mobile app. And right now, interventions are underway to have a mobile version of our very own HRIS system. But the attendance system, the dashboard are all mobile-based.
Presently, the Integrated Human Resource Information System is installed in 24 countries in Africa, Asia, Central America, and the Caribbean. In neighboring Democratic Republic of Congo, it hopes the Ministries of Public Health, Public Service, and Finance relocate funds away from ghost workers.
Previously, the absenteeism rates in some of these districts were over 25%. But when we started this activity of attendance tracking, in most of the districts retained, the absenteeism level has greatly reduced to below 5%.
The Integrated Human Resource Information System monthly report put absenteeism in Amulata at only 3.2% and at 11.2% nationwide as of May 2018. Now things are still getting better. This report was compiled by Jackie Achan for New Vision TV.